I would like to introduce the panelists today for today's session. We have Dr. Siddhart Ramesh Babu, who is presently working at Spot Hospital, Chennai, who completed both his undergraduation and post-graduation from Sri Ramchandra College, SRM Medical College MBBS, and Ramchandra Medical College Orthopaedics. Following that, he has done multiple fellowships, and he has completed his South Indian Arthroplasty Academy Fellowship. It's a 2-year course, and later he did few international fellowships also. And our next panelist is Dr. Terence, who completed his undergraduate and post-graduate both from Bangalore, and following that he was working as a consultant in Bangalore itself. Later in 2020, he completed his fellowship in sports medicine and is presently working at Ganga Hospital. Dr. Vasu, he fellowship, it's a 2-year hand course, surgeon, and he is presently he did few international fellowships also. And our next panelist is Dr. Terence, who completed his undergraduate and post-graduate both from Bangalore, and following that he was working as a consultant. And Dr. Bhaskara sir, he is he's a senior person. After completing his orthopedics from Sancheti, Pune, he did his FNB in trauma and critical care. Following that, he did a replacement fellowship at Ganga Hospital. Later, he has done a clinical fellow in bone tumors at Newfield Orthopaedic Center, and he has also got a Girdlestone scholarship from University of Oxford. So, and we have our one more panelist, Dr. Raghavendra, who is my post-graduation colleague from Karnataka Institute of Medical Science. Following that, he has done his Pediatric Orthopedic Fellowship from Indira Gandhi Institute of Pediatric Science, Bangalore, and a short-term fellowship in Arthroscopy. Following that, he was working as a registrar in Pediatric Orthopaedics in Ganga. Now, currently, he's based in AIIMS Rishikesh. And Nirdesh, he's also from my undergraduate colleague. He completed from orthopedics from Bangalore. Later, he pursued his fellowship in spine surgery from Indian Spine Injury Center, which is a dream for many aspiring spine surgeons. So I welcome all the panelists to this session, and we have a disclaimer. Please note these are the personal views and opinions of the speakers, and there are no conflicts of interest. And to begin the session, I would like to put forward this a very simple X-ray which is done by many just completed orthopedic graduates. So we have a distal tibia fracture. It's a closed fracture in a 40-year-old male. So a straightforward case. So everyone knows there is no second thought. It will be a nailing itself. And the surgeon has done this type of intramedullary nail. So will this fracture unite or not unite, or can this fracture be performed or reduced or fixed better? These are the many things which we can think. But my personal comments, and any of the panelists would like to comment on the X-ray. Raghu, can you comment on this, please?
Yes, it's a post-fixation of both one leg, but there is a minimal valgus with recovetum, but there is a almost like 3/4 seems to be intact. Only thing is that, proximal, there is also a proximal fibula fracture, but as it is a distal tibia fracture, it takes time to unite. So actually, dynamic locking would have been done, I think, proximal.
Yeah. Even I felt so. Rotation-wise, I'm not that happy. And even though this is a distal fracture, they have done only anteroposterior locking. They should have done a 90 degrees anteroposterior and lateral. That would have done a good reduction and stable. So when we think anyone can do a nailing, to do a good, perfect job, so it requires something special, to be trained under a very good surgeons, to see multiple cases. So that's where we want to reach, okay, accuracy and perfection. So with this, we'll be starting the session. So is fellowship necessary? So I want Dr. Bhaskara sir and Dr. Siddhart to opine about is fellowship necessary.
Thank you, Dr. Akash, for first of all, I'd like to say thank you very much for inviting me to this forum. So my thought is fellowship is definitely necessary, especially for arthroplasty. You do need to be trained in it. Because arthroplasty, it is a surgery which affects the lifestyle of the patient, and the joint is expected to last for at least around 15 to 20 years. So unless you do know the intricacies like patient selection, proper surgical technique, instrumentation, etc., you may land up with complications. And we do know if such complications do occur, generally they don't do well, and revision surgeries don't do as well as others. So in terms of arthroplasty and with the subspecialties that are mentioned, I do think that fellowship is necessary. So, Dr. Bhaskara, what do you think?
Yeah, thank you, Akash. Thank you, Siddhart. So, actually, the question is fellowship necessary? 100%. There's only definitely you need fellowship. The only question which needs more clarity is when is the fellowship necessary? So, why is a fellowship? So fellowship as such is for you, okay, you finish your MS Orthopaedics, DNB Orthopaedics, and then you're interested in arthroscopy or you're interested in spine surgery. In the Indian system of education or the Indian system of post-graduation, 3 years of training. So actually comparing it with the Western system of education, like in the UK, if you have to get into an orthopedic consultant from the day you join, you finish your MBBS, the day you start your orthopedic residency training, till the day you become a consultant, it is about 9 years to 10 years. That is similarly the time in Australia also. Indian system is slightly different. Like after you finish 3 years of training, directly as per the MCI, as per the Indian government, you can be a consultant. So, but that much of experience, the abroad systems have been made where if you have about 8 years after your basic orthopedic training, and then you need to go into the specialists where you do enough number of surgeries, only then you can become a consultant. So in the Indian system, definitely fellowship is necessary. There is no doubt about that. 110% in orthopedics, or not only in orthopedics, any field of medicine, any subspecialty like in obstetrics, cardiology, there are niche specialties. So to answer this question, fellowship is 100% necessary. The only question which I think will be of more clarity is when is the fellowship? When do you need to do the fellowship?
Yes, sir. Yes, sir. Thank you, sir. We have few set of questions which will be asked to the panelists in this forum, and anyone who are attending our live session, if they have any queries, they can put it across our chat box. I'll be asking the panelists. So just to reduce the technical issues or voice issues. Okay. My next question would be, So fellowships are definitely necessary. We'll be taking forward the question. Should it be a short term or a long term? So this is a question to Dr. Terence, because in spine and hand and microvascular surgery, there are no short-term fellowships. So all are minimum 1 year fellowships. So there is a dilemma for arthroscopy people, because multiple small, like 6 months fellowships are available in India under individual surgeons. So this is to Dr. Terence. Terence, sir, what's your opinion?
Hi, Akash. At the outset, thanks again for inviting me and compiling the whole program, getting all the specialists together. It's a great venture, and I hope all the juniors get benefited out of it. I hope I'm audible.
Yes, sir. Yes, sir.
So in scopy and plasty, I think this trend of having short-term and long-term is very much prevalent in India. I think the answer to this is what exactly that candidate wants and where he wants to go and settle back. And so that is one thing that you have to ask yourself. especially if you are in a small city where you are expecting that, you want to do majority of your work to be trauma, followed by some basic scopy and plastic surgeries. In that case, you have a small setup of your own, or you want to go back, put a clinic and you want to be a jack of all trades. In that case, I think a short-term fellowship will be sufficient. And especially in scopy, if you see, there are a lot of cadaveric training labs now. So you do a short fellowship to understand surgery for the patient. So I think one has to decide on what he has to come back and work on. If he's looking at coming and doing a work at a setup where he has to do everything, and also scopy or plasty, I think a short-term fellowship would be sufficient. But in a case where he wants to do only arthroscopy, because every field now is so vast that you can start doing it on its own. Like, for example, scopy, we have knee, we have shoulder, we have elbow, wrist, hip. So not all surgeons do a lot of these surgeries. So you can develop individually and you can do and market yourself to be an arthroscopy surgeon as well. So if you are looking in that perspective, a definite long-term fellowship is required, which will give a long perspective on handling patients, and also will give you a definite more hands-on when you're working at a center. I hope that clarifies your query.
Yeah. Thank you, sir. Thank you, Terence, sir. Siddhart, what's your opinion about arthroplasty? Because primary surgeries.
So I don't think that is possible through a short-term fellowship or just immediately during our DNB or MS or diploma training. So you do need to get specialized in it. So to prevent the complications, I do think it is necessary that an arthroplasty fellowship is necessary to prevent such catastrophes from occurring.
Okay. So my next question is, so if you are planning for a long-term fellowship, so will you be practicing only scopy, plasty, spine, pediatrics per se, a specialty, or would you be also handling any trauma or any other orthopedic pathologies? This question is to Dr. Vasu, sir, because he has done hand and microvascular. So I'd just like to know whether he is doing any other trauma also along with this.
Yeah, hi Akash. Thank you for inviting me first. And thanks to the White Army for organizing such a great event. Involving in trauma as well might fetch you more cases, but over a time, you may not grow as a hand surgeon. That's my feeling. And I have seen many people who has done probably a short-term fellowship or observership with some hand surgeon doing trauma as well as hand. They might do basic work to some extent well, but they may not be able to do a great job when they are involved in so many specialties. And you may not be known as an exclusive hand surgeon. If I am doing tibia nails and femur nails and IT fractures, I doubt I can grow as an exclusive hand surgeon. And it's been nearly 3 years after my fellowship, and I have been stuck to only hand, and I'm doing foot as well, diabetic foot actually. That's my interest. So I got some short-term fellowship in that. So I'm doing just hand and foot surgeon, and all the people in my hospital knows me as a hand and foot surgeon. And whatever the problem is, they come to me first. They won't go to the orthopedic surgeon. They come to me directly. So that's how you identify yourself, by practicing exclusively to the long-term fellowship you have done. And I would suggest, especially I'm talking about my hand surgery experience, this may not be applicable to other specialties. Hand is a completely little bit deviant from the regular orthopedic specialty. So practicing exclusive hand would be a nice idea. And you may think that you may not get cases. That might be the true scenario in initial few days. But I have seen from my first month itself, I have been doing decent amount of hand surgery cases, though I am exclusively practicing hand surgery and foot. Yeah, I think you should practice when it comes to hand surgery, I must say.
Yeah. Getting a straight for a tibia fracture to your clinic or emergency, it's very tempting to do a nailing. So
yeah, I have done only 3 so far. Those 3 are actually compound tibia fracture where I need to debride. I go for debridement actually. So whenever there is a bad compound, they actually call me for debridement. I debride the wound and they fix it normally. So these 3 tibia nails, what I have done was just to show that I can do tibia nail and I don't want to lose the touch of it. That's it. And I have done decent job, not great job. I must say that. And I have debraided and primarily nailed it. That's why I did tibia nail. Otherwise, I don't want to do tibia nails.
Okay. So Siddhart, do you have any questions, Siddhart?
Yeah, I would just like to add to what Dr. Vasudeva Reddy said. I do think it is also dependent on the place you are working and your own professional thought process. So if you do want to be exclusively one particular specialty, I completely agree to what Dr. Vasudeva Reddy said. But if you are working in a college setup or an institution, you may have to be a jack of all trades. So that is my opinion on that. It is also dependent on where you are working and your own professional thoughts.
Yeah. I just want to add a point to that. I must say that I'm in a 2-tier city now, so I can practice exclusive hand surgery, not in a small town. When you are a hand surgeon and you are in a small town, I think you need to do all the platings, nailings, and all that. But when you are planning to settle down in a city or a referral center kind of area where patients come from all around, I think you can practice exclusive specialty of yours, at least after a few years from your beginning of career.
Okay. Thank you, sir. So my next question. Yes, sir.
Akash, I also would like to add a point to that. Like this discussion, I think me and Vasu have had many times. That when you're growing in a specialty, this is to what Siddhart also said, that you have to decide, for all the juniors who are watching this, you have to decide whether you want to be a jack of all trades or you want to be a master of one. That is one thing that you have to decide. Second, you decide about the place where you want to settle, whether it's a small place where you want to do all specialties or whether you want to grow in one. And if you're growing in one, like if you're doing hand surgery, if you keep doing this tibia nails, no trauma surgeon will refer a carpal tunnel syndrome for you for your release, right? So you respect your specialty. You don't take away others' cases. You stick on to your specialty and you do your specialty, and you expect others to refer the cases to you. That's how you grow as in your own specialty. That's what I would like to add.
Okay, sir. Thank you, sir.
Thank you.
We have a chat question from the participant. So, Nirdesh, the next question would be, where to do a spine fellowship? Which are the good centers, and what is your take on this? Is a short term required or a long term, or what's your call?
Well, at the very outset, I would like to thank White Army and also OrthoTV for giving me the opportunity. So, what privilege we didn't have 2 years back, because we didn't know how to prepare for FNB and rest of the exam for spine. So maybe this would benefit for the people who are attending this meeting. So coming to the point, for spine, definitely I would tell it is a long term, never short term, because the time your consultant gets confidence in you, it will take a long time in spine, unlike other specialties, what I feel. So it is definitely long term, maybe 1 year and plus, and not less than that. And considering where to take the spine fellowship, it all depends on, in India, there are different kinds of fellowship. I would like to classify them majorly as the one which you go through the exam and one which you do not take any exams for, right? So the one which you take exams and write is the FNB, Fellowship of National Board, and ASSI exam, Association of Spine Surgeons of India. These two are 2 years fellowship. And there is also MCH Spine Fellowship in Rishikesh, AIIMS, that is for 3 years with a good research activity which is going on over there. And 2 year Spine Fellowship in AIIMS, Delhi under Dr. Babu and Dr. Sharat Chandra. And PJ exam for spine, that is for 2 years. These are the exams which you take through the exam. You write exam and you take the fellowship. For this, I don't think your CV has to be a good, it has to be good, but they will not see the CV in fact. As far as the fellowship centers in India where you need not write exams, so there are professional bodies which give spine fellowships in India. For example, you have AO Spine Fellowship, which is a short term, that is 1 year, 3 year, and 9 year fellowships. 1 month, 3 months, and 9 months fellowship. So I would rather suggest AVO spine fellowship to be taken, the one which is more than 9 months, or a 9 months fellowship at least, right? So, and in every other states that the universities give fellowships. For example, in Karnataka, we have FRGUHS fellowship in Sanjay Gandhi Trauma Center. We have MGR University fellowship in Ganga Hospital and few of the centers in Madurai, like Preeti Hospital. We also have AISA fellowship, that is Indo-American Spine Fellowship, which is given in Indian Spinal Injury Center, collaborating with American centers as well. And few of the honorary fellowships are present. And especially in Mumbai, you have fellowships which are under particular consultants, so which are for 2 years under Dr. Gautam Zaveri, Dr. Mihir Bapat, Samir Dalvi, and in Stavia Hospital, Ahmedabad. So if you want to take a fellowship that is without exam, you should have a good CV. You should have done a very good research before, right? So there will be interviews for that. And through any exams, if you are going, I mean, if your CV is okay, it's fine. So you can give these exams.
Okay. Thank you, Nirdesh, for the elaborate centers. Dr. Raghavendra, what do you suggest? What are the options for a pediatric fellowships? Raghu, your mic is mute. Yeah.
Right. So compared to other specialties, PEDS has got a vast variety, because nowadays it is recently it is expanding like anything. So PEDS has got subspecialties in it, like neuromuscular, pediatric trauma, pediatric spine, pediatric hand, and pediatric congenital disorders. So it is expanding in the coming years, especially in the coming down the line, around 10 to 15 years down. So it will be further subdivided. So where the surgeon will be going to specific points. So I prefer pediatric always is a long-term fellowship. It needs at least minimum of 1 to 2 years minimum. Less than that, I don't advise them to take a short-term if they want to practice a PEDS. Okay, and PEDS it needs always associated with other pediatric orthopedicians, geneticists, and other endocrinologists. It needs a set of team rather than working as an individual. Especially PED trauma, you can do it, but PED conditions you need to diagnose. So where you need a help of other surgeons. So better to work in a cities. If you're planning to settle in a 2-tier cities or 3-tier cities, I advise them to take a PEDS. If you're going to low-down cities, better not to. I advise not to take them a PED ortho. And there are many fellowship centers in India which started, and recently they started 3 years fellowship MCH in PEDS. Rishikesh, Chandigarh, CMC Vellore, and Manipal has got MCH in PEDS. Apart from that, POSI has got accredited few centers where you can do a fellowship in India. So where you got around 7 centers, which are, as of now they are accredited. A few more centers are going to add up. So where Ortho Kids from Gujarat and KJMU in Lucknow, Wadia from Mumbai, and CMC Vellore has got both the MCH as well as POSI fellowships. Indira Gandhi Bangalore and Ganga Hospital Coimbatore and Sancheti Pune. These are all the POSI has accredited. These centers has got better caseload and better patient input. So these are accredited by Pediatric Orthopaedic Society of India. Apart from this, there are state fellowships which are taken by few states, like MGR fellowship again in Ganga Hospital, and Indira Gandhi has got a state fellowship from RGHS. Apart from this, Delhi has got Chacha Nehru fellowship, SRCC from Mumbai, Jupiter in Mumbai, and Rainbow Hospitals in Bangalore. These are all various state RGHS related, or Maharashtra University has advised, they have proposed these fellowships, and various states have got various fellowships. But I advise all the students who are interested in PEDS to, at least if they're thinking that they are planning to settle in B-Town or B-Town to Tier 2 or Tier 3 cities, to take up PEDS. And it needs definitely a long term as it is expanding. So definitely I advise them to take a long-term fellowship.
Okay. There are a few questions from the chat box, like to enumerate the good centers in India and to repeat the centers. So at the end of the session, we have displayed the email ID of all the subspecialty people, panelists who are here. please you can mail them, so they'll be able to have a correspondence. I'll guide you further. Okay. Raja Bhaskara sir, what is your opinion on where are the good centers for orthopedic oncology? Okay. Probably some network issues. Okay. Vasu sir, okay, there are less options for hand and microvascular in the country.
Yeah.
Are there any other fellowships other than FNB, and how many seats are there in FNB for hand and microvascular specialty?
Yeah. FNB is a 2-year course, as we all know. There are 5 FNB seats in Ganga Hospital, Coimbatore, and I think 1 or 2 in Shere, Kashmir. One institute is that they are doing FNB hand surgery, 2 seats, and Rishikesh AIIMS has MCH program in hand surgery. CMC Vellore has 1 seat of hand surgery, and Sri Ramchandra Medical College in Chennai has 1 hand surgery seat. And recently Manipal got 1 MCH hand surgery seat as well. So there are something like 4 MCH and around 7 FNB hand surgeries. And apart from this, you do have short-term fellowships like 1-year programs, and which are university registered, like MGR University from Tamil Nadu. They have a couple of university fellowships in Ganga Hospital, and even in Bombay, there are a couple of 6 months fellowship courses for hand surgery. But I must say that 6 months is quite less time to learn in detail about hand surgery. So you should go for a long-term fellowship like FNB or MCH programs. But when it comes to MCH programs, these are all centers are very new. I'm not very sure how structured the programs are for 3 years exclusive hand surgery. But whatever internet research I have done, the comments have been like they are not doing proper hand surgery and they are doing more of plastic-related work. I'm not very sure about how the MCH programs in other centers, but you must know that they are very new programs which are started, but you should be skeptical in taking. And you all know that MCH is always better than FNB, but that's your personal decision, whether you have to go for MCH program or FNB program with good exposure. So you should strike a balance.
Okay, thank you, sir. Now we have Raja Bhaskara, sir, who will be...
Sorry, Akash, this poor connection. Okay. So regarding orthopedic oncology, it's like in the ratio of 1:100. If there are 100 people who are doing other specialties, it's only 1 person. The main reason for that is because it's very, very the caseload, and even you need to be in an institutional or specific cancer centers or big institutions which have the supplementary care like vascular surgery, very good supportive plastic surgery. You need an oncologist also, and also the MDT for you to get a very good outcome in that. So as of today, the best oncology training in India is the Tata Memorial Hospital. They have the 2-year fellowship. So they have an exam for that, and they prefer people who are experienced and willing to commit it to do oncology work, and it's very, very hard work there. So that is the #1 training center in Tata Memorial Hospital. It's a 2-year fellowship. And there are 2 seats they take every year. There's an exam. You have to write that and then go. The second fellowship is with Professor Manish Agarwal, who's one of India's pioneers in orthopedic oncology. He is now in Max Nanavati Hospital in Mumbai. So Sir has 2 fellows with him. So Sir takes fellows and he has an interview, and it's on his basis, on his own preference. So, which is also a very good orthopedic oncology fellowship. Apart from that, in AIIMS, they have a fellowship in Adayar. They have fellowships where surgical oncologists also, you have to rotate through the specialties and then get to do through that. This is in India. So in India, these are the 2 main centers. There's also the other, which the Indian Musculoskeletal Oncology Society, they have a fellowship which is not only for orthopedic oncologists, even for the other subsets like pathologists and everyone, where you can choose a center. But very importantly, they select people who are committed for that. They don't want you to learn. They want people who can do and who are experienced. So basically, after MS, if you have finished 3-4 years of some training, they give you more preference. Abroad, where I was trained, especially in Birmingham and in Oxford, it's a totally different way of, you have to write the MRCs, get your accreditation, and then do it. So orthopedic oncology, compared to other things, you need to first get your trauma and your arthroplasty and your even a pediatric knowledge fellowship, because all of these are very important aspects which in decision making, and then you have to do the orthopedic oncology fellowship. So it's a slightly longer run.
Thank you, sir. Thank you. Just a question, sir. Is orthopedic oncology done only by an orthopedicians, or are there any surgical oncologists who are doing this branch? Is there a gray area?
Yeah, so exactly. Just like, spine surgeons, neurosurgeons overlapping. If you have, for example, a thyroid tumor, a surgical oncologist can do it, an ENT surgeon can do it, or a head and neck surgeon. So all of them. So today in India, for surgical oncologists, they manage about 60% of the soft tissue tumor work. So bone and soft tissue tumors, that sort of comes as sarcoma in orthopedic oncology. There is about 50-60% of the work, any cancer case is today in India is done by a surgical oncologist. Apart from, otherwise they get referred to higher centers. So there is an overlap of cases. So even if there is a malignant tumor, even in peripheries, a surgical oncologist goes and helps in dissection, and suppose there is a joint which needs to be replaced or limb preservation procedure, an orthopedic surgeon then gets involved. So yes, there is a big overlap. And
Okay. Thank you, sir. Even in spine as well as hand surgery, there's an overlap between a neurosurgeon and a spine surgeon, and even in hand, there is an overlap between a hand surgeon as well as a plastic surgeon. So the next question, sir, would be, this is all the panelists. What do you choose? Is it hands-on, academics, or what it is?
yeah.
Terence, what's your call on this? Terence, your voice is mute.
I think a fellowship should be a combination of both. Can you hear me?
Yes, sir. It's good.
I think a fellowship should be a combination of both, because there is no point in working 24/7 without understanding what basic principles are, what are the recent trends, and in what way you have to think further. What are the recent advances? Those you get only with academics. So it has to be a balance between the two, and that will be a good fellowship. You should have decent assisting along. Obviously, no senior is going to give you straightforward cases, right? Because all are private patients. If you have to assist, you have to learn how you're going to do, because it's some specialties like, for example, like spine or scopy are not very well dealt in your post-graduation. No much of an experience will be there. So it takes you time, maybe the initial 3 to 4 months, just to get a hang of it. And then, you slowly get hands-on. You cannot expect, especially for the juniors, directly to come in and start doing scopy. And especially this cadaveric things should be done simultaneously, so that your consultant also feels confident for you to get given his private cases. So that is one thing. A good academics in the center is very, very important. That keeps you updated. That keeps you thinking on the concepts, and also to put your papers in and publications, which are very, very important and which can be easily done in good centers. So I think it should be a good balance between the two.
Okay. Nirdesh, do you want to contribute something for this?
Yes, I would like to add on few things. That is, along with this, we should have added probably hands-on or academics and research. Especially as far as spine is concerned now, so spine is no more a general spine now. So it is again divided into endoscopic spine surgeries, minimally invasive spine surgeries, your deformity corrections, right? So what we have to be having is a good CV. So at the end of your fellowship, you need to have a research work done and also a good CV, so that you can get a good fellowship outside India or within India, especially these maybe super specialty. Now spine itself is a super specialty. So over and above that, it is again subdivided. And as far as spine is concerned, I would definitely go for hands-on. Hands-on is must because unlike other branches of orthopedics, spine and hand and microsurgery are the one which needs a very soft skill, right? So which will not come just with the observation. You will learn the technique, but you will have to do it, especially in spine and hand and microsurgery. So I would go for hands-on. Hands-on is the first thing I would like to choose if at all I'm searching for a center. Second, coming to academics. Yes, academics is one which will help you to inculcate good practice. So what it is not always what you have to do. It is also that you should also know that what wrong you are doing, right? So if you know what wrong you are doing, that has to come only with the academics. So hands-on first, following that is research, and next comes your academics.
Okay. Thank you. Thank you, Nirdesh. This question is to Dr. Raghu. See, you have worked both in a government setup like Indira Gandhi, and even you have worked in a Ganga hospital where there are very fine-tuned, refined work they do. So how different is it to work in a government setup and as well as a corporate like Ganga? And what do you suggest if there is an option between where too much of hands-on like in government or to go with the academic institutes?
So here I would like to say that it needs a balance between both. So not just a hands-on where you get, but without academics, without knowledge, you can't go and just operate there. So for that purpose, better I'd like to suggest if it is better to go ahead with academics, research as well as hands to be go hand in hand. Not like that just you be getting a hands-on, go operate and come out, but you should know what you're doing wrong, what you're doing correct. For that, academics and research is more important along with hands-on. So I would differ from others relatively here because I would like to say that better to work in relatively more centers rather than staying in one center and learning only one thing. Because in PEDS, as I said, I suggested many fellowship centers. So out of which few centers has got few advantages over the other centers, right? So for that purpose, I would like to say that few centers has got hands where they combine the hand, upper limb as well as PEDS, but other centers have got only a lower limb where the hand is completely different. Let's suggest like club hands where the plastic surgeons operate together with the hand surgeons and the PEDS. All three of them will be in compete with that. So, but you'll not get as a ped orthosurgeon, you would like to know everything in pediatrics, especially pediatric related things. So, and few centers has got completely separate PEDS spine, and PEDS is completely different, right? So, the way the spine cases of PEDS will be completely referred to spine center, and only few centers has got a pediatric spine exposure. Similarly, only few centers has got completely cold in ped orthopedics, but no trauma at all. So, where I worked in government hospital, where there was no trauma exposure, but I would like to get all sort of cold cases relatively, as PED spine, PED hand, and PED lower limb cases, all cold congenital deficiencies. But PED trauma purpose and other fine tuning purpose and academics and research was better in Ganga relatively. So for PED trauma, PED research related things and academics, it was far better in Ganga compared to IGSH. But variety of cases and hands-on was far better in Indira Gandhi compared to Ganga. So both the centers helped me in learning one or the other thing. So better to work not in one center, but in different centers for long term, at least 1 year in each centers or else 6 months in each centers. So, but you need different exposure from different surgeons. So that provides you finally better surgeon, I feel so.
Yeah. Thank you, Raghu. Now, this question will be dealt by Dr. Siddhart. What's your opinion? Because Siddhart has done a SIAA fellowship and it is in 4 different institutes in South India. So when we are doing after a DNB or MS ortho, we'll be around 26, 27, probably a time when you will be getting married and a lot of other responsibilities. Should we decide on centers based on the stipend? What's your take on this, Siddhart?
Yeah, Dr. Akash, you hit the bullseye on that. So rather than stipend, so I think that stipend should never base any of your decisions. So rather than a stipend, you need to have an understanding and loving family. So if during your if you are doing your fellowship when you're a bachelor, it's so much easier. But if you are married, you do need to convince your family and the importance of the fellowship. So stipend should not play a role because another thing. So a place where you learn, you generally don't earn, and where you earn, you don't learn. So those are my thoughts. So stipend should not influence your decision. You have to talk to your family members. You'll have to make them understand the importance of the fellowship and the long term, the length of the fellowship, and that is how you should go about the fellowship. Those are my thoughts.
Okay. Thank you. Anyone wants to contribute to this?
Yes, I would like to tell a few words. Especially if you are considering a center, considering a stipend as the main thing, because you are here to learn. I mean, so this has to be a second one. First has to be a hands-on, then comes the stipend. I know, I mean, there are, it is difficult at this point of time, but at the end of your fellowship, you'll know the value. So choosing a center based on a stipend is wrong thing. So I would tell it is the clinical work and the hands-on work. What you do, what you get is how you should go for.
But Rajashekaran, sir, you want to comment, sir, on this?
Yeah. So actually, for me, it's quite a, you put me in soup, because, we also run the hospital, and we, so stipend, how much to pay people. So I think definitely you need to have a stipend, only why thing is, only if you work, when you work and you get only doing work after, maybe 1 or 2 months, once you get very hard, it's very difficult for you to run the family, everything. Definitely you need a stipend. And I will just put it even more, saying that in today's scenario, at least 50,000 a month in 2022 will be a good. Some centers give you very high. I think that should be at least a bare minimum for any person, or even the centers who are organizing it, right? At least 50,000 a month in any city of India. And I think that is how even this, because I was there in the South Indian Arthroplasty Association fellowship with Siddhart at them. That was one of the most important points, which all the founder members who are very senior people, they described it, that, most important thing is we should give a stipend to them. But as all the other panelists said, any person who decides, or any person who's willing to take a fellowship, if they decide centers based on the fellowship, based on the stipend, then because you're learning, your willingness to learn and the willingness to work hard, and that should be your first criteria. And as for people who are running the fellowships, they have to get a stipend. So I would say stipend keeps you even, mentally satisfied, gratified and all. So a stipend of 50,000 is definitely necessary, but as all the others said, you should not keep that as the main criteria for your planning.
Yeah. Okay. Thank you, sir. Thank you. Just a note at this juncture. Those 6 months fellowship, short-term fellowship, those the stipend varies. It depending on the surgeon who is offering the fellowship. Whereas when there is an association sponsored or FNB, SC, the stipends are fixed throughout India. So these associations the stipend offered is more than the individual surgeon offered.
A small correction for this. I'm sorry to interrupt. As far as FNB is concerned, it is based on the same as SR pay in that state. So FNB in South Indian states, we are getting a less salary compared to the one which is in Delhi or in Kolkata. So the stipend is quite high compared to the South Indian state FNB centers. So it is based on the SR pay of that state per se.
Yeah. Thank you. Now the next question is to Vasu sir. Is fellowship just a certificate, or is there any legal issues when you're handling an open injury or a hand or surgeries? So do you think this FNB hand surgery or any certified course, will it help in court scenarios? Okay.
So Akash, can I answer that?
Yeah, yes, sir. Please, sir.
So fellowship, as per the Indian medical legal system, if you have finished your MS orthopedics or even your D ortho or even DNB, you are clinically, as per the law, competent to manage any orthopedic injury, okay, which involves open injury, trauma, arthroplasty, arthroscopy. So doing that, you cannot be faulted. This is the court of law. But today, patients are very much aware that, when they see, and patients in today's thing where there are a lot of doctors, a lot of institutions, they can even pick and choose, okay, based, if he's done a special fellowship in spine surgery, he's got more knowledge. And even in clinical decision making, even the institutions or corporate hospitals or even the smaller hospitals which appoint people, they only look for fellowships trained people. So fellowship, whether fellowship is just a certificate, most of this is even with the candidate. Some people just want a certificate. Many of the foreign fellowships which people go for, 3 weeks, even to non-English speaking countries, that is just for their certificate point of view. But you have to decide that in your clinical fellowship, which is the long-term fellowship which you're going to do, that is going to be the bread and butter. It's not a certificate. It's in fact, that's your life actually. Every single day, even in the ward or something, that's a life. So fellowship, especially the long-term clinical fellowships, which you are going to specialize in with spine or arthroplasty, it is not a certificate. It's much more than that. It's in fact your life. It's your entire career, in fact.
Okay. Thank you, sir. Thank you, sir. So the next question will be to Dr. Terence, because Terence, sir, has completed his fellowship and he was working as a consultant in Bangalore, and later he took up FNB Orthopaedics. What is your take on this, sir? When will be the ideal time to do a fellowship?
I don't think there is a clear-cut answer to this, but from my perspective, I would like to tell something. Actually, there are two ways of thinking about it. One is whether you need to do a trauma. If you are in a center where you have not done enough trauma, you're not very confident of handling all the trauma. Whether should I do a bit of trauma first, 1 or 2 years of senior residency in a good volume center so that you get basic hands-on confidence and then go to a fellowship, or whether a 1 year a senior residency somewhere is good enough and then I straight away immediately after my post-graduation I plan. So earlier, I think all the trained orthopedicians, all the seniors, everybody would suggest all the juniors to do trauma first. And there is a good reason why you need to do this, because every specialty is an extrapolation of trauma. Basically, if it is plasty, spine, or even scopy for that matter, at times you should have that basic idea of handling trauma and doing the basic trauma in some of the areas, and having that confidence helps you a lot in growing in your specialty as well and picking up your skills as well. So I think this has an individual perspective to it, but I feel that is maybe at least 1 year of doing bare minimum of doing trauma is very important, and then going to a fellowship. So that is one way. But if you take it too long, so in my case, I did around 2.5 years of senior residency before I got into fellowship. I wasn't late, I felt. But only problem that happens is, I think one has to consider that the fellowship is a little bit of something like post-graduation. You have to be on your toes every time. You are no more having all those luxuries of having being a consultant back on how you were working before. So it's something like a glorified post-graduation with some advantages to it. So if you are humble enough to go do that hard work, go do all those dressings in the ward, go handle all the ward patients, come back to the OPD, handle the OPD, then go back, do your research. I think if you are humble enough and you are courageous enough to do that, I think there is no age bar. But I think 1 year of minimum of trauma and then going will be ideal for any fellowship, I would feel. I don't know what others would opine on that.
Panelists, any suggestions or opinions regarding this?
Yeah, I would totally agree with Dr. Terence. There is no such thing as being late or being early to learn, especially in our profession. So we can learn anytime. So when I went to Dartmouth for a short-term arthroplasty fellowship in Boston, so I had there was a fellow in arthroplasty, and that guy was 45 years of age. So you are never late to learn anything. You are never late to know what your passion is. You should know that this is my passion and I'm willing to slog for it. So there is no such thing as being late. That is my thought.
Okay. Nirdesh, what's your call on this?
Well, considering considering post-graduation, how much of trauma have you done is the main thing which will decide whether you are late or whether you are early. So if you have done your post-graduation from a very high volume center where you have got a very good hands-on, I don't think you need to do an extra hands-on skill to know the general orthopedics, right? So once you finish your MS orthopedics, you can directly go to fellowships which are based on the exams. So, and if you have done from a private medical colleges where the hands-on is quite less and you have only supervised cuts, and you would want to be in a situation where you do not have any supervised cuts, then definitely I would say that at least SR-ship for 1 year is must. So if you have done from a very good government college where you do in and out trauma, then directly go for fellowship. Don't waste time, because after fellowship, and as far as spine is concerned, after fellowship, you still have subspecialties again streamlined. So the more you want to learn or the more you want to get specialized, the earlier is better.
Okay. So if someone has completed orthopedics from not that good hands-on center, so any suggestions for a good SR-ship for trauma skills?
That you should tell, maybe. Well, Ganga has got a very good trauma registrarship, so you can take it over there, or any SR-ship in government medical colleges. So you finish your SR-ship over there. So at least you will have a confidence that yes, I can handle a general orthopedic things if something goes wrong when you are doing your specialty. So after that, maybe last 1 or 2 months, prepare for your exams and just move out.
Yes.
So, and you have done your MS ortho from a very big institutes where you have done your, and you are tired of doing trauma, right? There are many centers like KEM, Mumbai. You are tired of doing trauma, then just directly go for fellowship.
Okay. Terence, you want to comment?
Yeah, I want to add one point here, Akash.
Yes, sir.
Yeah. Doing immediately after orthopedics, it depends on your specialty and way in future. Like if you want to practice the specialty, I think you should go for a fellowship directly in case you get the entrance cracked, you got the seat and you go and have it. Especially take me as an example. I'm doing exclusive hand. For that, I don't need to do exclusive trauma exposure because I decided that I'm not going to do a trauma in future. And coming to the busy center and not so busy center, I have seen many of my colleagues doing like hundreds of TBI and saying that I have done 100 nails, 100 PFNs. By the time I have done just 2 PFNs and 1 hemi arthroplasty as an MS orthopod. So I was pretty much disappointed that time. But it all boils down to how principled they are, like, how much trauma principles they know about it. Like example, the first X-ray you have showed, the nail could have been more lengthier. The interlac could have been in multi-axial, all that points. You get to learn in a good center where you may not do great hands-on, but you will be seeing a lot. But you will be getting to do once in a while few cases. That is more important, I feel, rather than doing in and out every day principles and just that and interlocking properly. I think you should go for a center where a teaching program is also good and where a little bit of hands-on is there, not completely absent.
Yeah. Yes, sir. Yes,
example would be Ganga would be a better center for doing trauma registrarship, I would say.
Terence, sir, any comments?
I think more tend towards Nirdesh's idea. But it's a very it's there. As I said, there is no clear-cut way of going about it. So even I would tend towards Nirdesh's answer that especially in areas like Scopy, where for example I get a GT avulsion. Hello.
Yes, sir. You're audible, sir.
Yeah. So a GT avulsion or maybe a glenoid rim avulsion, you post for doing a arthroscopic fixation. and it's very difficult at times. There's a lot of swelling. You want to open it. You have to open it at times if it is very difficult. And when you open it, if you don't have the basic idea of going and fixing it, then it becomes a little difficult. So as Nirdesh said, if you're in a very good center with a very clear idea on trauma, then I think there's no need for you to waste one more year and delay your specialty. But if you're not confident at the end of your MS, you feel that you need some more experience to get the basic idea of fixing fractures, you're not very clear about it, somewhere in future, if you're stuck, there's no coming back to it, then in that case, 1 year would be ideal, I feel. I think that should give you, in a good center, in a balanced center, would be a good idea before you go for a fellowship. I think that would be my take on it.
So those who are lucky to get through FNB, okay, where they won't ask for any experience. But if you're applying for a fellowship in a particular surgeon under, or even an ASSI fellowship or SIAA fellowship, they'll be asking they don't want to amateur postgraduates. So these places, if you're planning, then definitely you will need 1 or 2 years of experience post-graduation. Bhaskara sir, please, your comments.
Yeah. So just to update on all of you, am I audible?
Yes, sir. Yes.
So just to update all of you, now FNB trauma, FNB had in orthopedic specialties, arthroplasty is come now. There are about 20 seats, arthroscopy, spine, and trauma and critical care. I had done FNB trauma critical care from 2015 to 17. Now FNB is now changing the rule. So I did about, out of my 24 months, 20 months was trauma, 3 months was in abdominal surgery, neurosurgery, all. Now the FNB trauma is now FNB National Board wants to keep it only for general surgeons. So anyone who wants to write FNB trauma, the scope is changing from next year onwards. They want only general surgeons to do it who are able to do laparotomies, splenectomies, neurosurgery. So anyone who wants orthopedic surgeons, of course, orthopedic surgeons, we only want to focus on orthopedic trauma. So FNB trauma, that is not the route for you, just to update all of you. This has been a new development by the National Board. Only general surgeons people, they want to do this course. Okay. So FNB trauma is going to be only for general surgery people hereafter.
Okay. Thank you, sir. That was a update which I think many of us were not aware. This is for the Vasu sir. Most of the panelists here are from the metros. You're the one who is practicing Tirupathi. And what is your take? Your specialty is a gray area of a plastic surgeon as well as a orthopedic surgeon. And do you get so many referrals to be a super specialist in a city like Tirupati? So Vasu sir, your voice is not audible.
Can you repeat the question, Akash? I could not actually. I had a signal issue. Okay, sir. Among the people, all the panelists here, all are in the metros. You are the one who is in not a metro like a Tirupati place like Tirupati. Having a super specialty like this, where everyone can do a K-wiring for a finger or do a carpal tunnel. Okay, what is your take? Is a specialist required in a two-tier city? Yes, absolutely required, Akash. If you take the two-tier cities, they're the feeders to these metro cities actually. From here only the patients go to Chennai or Bangalore if you take my place. And once the specialist is available within a small town, I think they will search for you and come to you. I think everybody does this.
Okay.
Could do a little K-wire. The fellowships may train us. And two-tier cities, when you take hand surgery, there are very few hand surgery. Hello, am I breaking?
Yes, sir. Yes, sir. Some network issues. Some.
Yeah. When you take hand surgery, there are only few seats.
Audio.
Vasu sir, are you there? Okay. Terence sir, does it matter?
Can you hear me now?
Yeah. Vasu sir, it's better now.
Yeah, when you take take hand surgery. The hand surgeons are less in number. So I'm the only hand surgeon in this Rayalaseema region, though I am staying in Tirupati. So I tend to get a couple of cases from here and there.
Okay, sir. Okay. So specialists are required in throughout, and it should be uniformly distributed, not just concentrated in metros. It's your take, is it? Okay. So I think we discussed about trauma skills in the previous slide. So this question is to Bhaskara sir, a good center or a good mentor. So you want to have one single surgeon under whom you want to work, or you want to have in an institute where multiple surgeons you have an opportunity to learn from? What is your call, sir?
Yeah, so 100%. One of the big aspects of fellowship is mentorship. So when you are with a consultant or even with a group of consultants, not only operating the way they even their outlook, the way they talk, the way they behave with the patients, the attenders, that is also a very big important aspect. So, many people, whenever they ask a fellowship, they just ask, okay, is there enough number of cases, or is there enough amount of cutting chances, enough number of academics? That forms about 50-60%, which I would say. To really progress, every day is a mentorship, like even with the team people, the way, how they behave, how they talk with the entire group. And if you have to extrapolate that to your practice, it is very important how you imbibe their important skills and knowledges. So I will always suggest that, you need to be anyone, even if you are with one surgeon or with a group of surgeons, you have to treat them like mentors. You have to be willing to imbibe and learn. So mentorship is very much essential. It's very, very important. Mentors in fellowships. And that the most, the more you are with them, if you see in your practice, when you finish your fellowship, you will be following whatever they do. 90% of the practice will be what are the skills and what are the principles you learned there. So it is very important. And so always you have to choose very good mentors also in your fellowship.
Okay, thank you, sir. Sir, now next question is to Bhaskara sir and Dr. Siddhart. How to go about a foreign fellowship after your Indian fellowship or inland fellowship? How to apply, and before, is it 6 months or 1 year you want to mail the consultants there, or how to go about it?
So I would think that Bhaskara sir will be better equipped, but I'll just give you my thoughts of how to go about a foreign fellowship. So definitely you do need to be initially trained within India. So that will give us the better hands-on, and a short-term type of fellowship abroad or an observership also will help us to keep in tune with the present scenario. So so I did it at Dartmouth Hitchcock Medical Center. That center was a little, so that center is associated with I'm an alumnus of Ramchandra Medical College. So I had just attended a short interview, and then they welcomed me aboard over there. So after knowing that I was interested in arthroplasty, the arthroplasty unit over there did give me a opportunity to observe over there for a couple of months. So the cream of the cream for arthroplasty is the Hospital for Special Surgery, which is in New York. So that is the Ranawat Fellowship. So for that, you do need to have a really, really good CV. You need to have quite a few research articles, and you have to also, when you attend that interview, you should have a PowerPoint presentation prepared that why you are the appropriate candidate to be selected over there. So yeah, so those are my thoughts. So I think Bhaskara sir will be better equipped to answer that question.
Yeah. So thank you, Siddhart. So actually, I'll just take Siddhart's example. So, there are many arthroplasty fellowships in India, but 6 weeks, there are even 6 months fellowships, 1 year. But of all of them, Siddhart will be very much well equipped and very well experienced because he has done a completely 2-year fellowship. He has done a 2-year fellowship focused in arthroplasty in 4 very good centers. So he must have seen almost all the complex surgeries, all sorts of arthroplasty, definitely. So he'll be one of the most equipped arthroplasty fellow trained surgeons when he's finished the 2-year fellowship. Now, if Siddhart goes to Dartmouth University or a short-term fellowship, it's just like icing on the cake for him, because he's very well equipped, he's very well trained, he's done all his basics, he's invested 2 full years in arthroplasty, and then if he does it, it's very useful, it's icing, it's a cherry for him. Whereas if a young person, if you finish your MS, directly if you go to a small fellowship like, Endoclinic or Korea or even US, it's not going to be very helpful, because directly going for 6 weeks, you won't learn the nonsense. So if you have to do these short 6 weeks fellowships, you have to be extensively trained, extensively having your base covered. That is one aspect. And there are many 6 weeks or short-term fellowships in arthroplasty. One of the gold standard is the Endoclinic fellowship in Germany, but it is completely German speaking. Coming to the most important point, US or UK, you need to finish, if you want to do a long-term fellowship, you need to finish their licensing exams. In the US, it is the USMLE. In the UK, it is the GMC registration. To get the GMC registration, you can either clear the MRCS, directly go in, and there are different paths to that. And once you do that, it's about 1 year. You go into the system. You become a fellow. You are in the system. You work. You become like, you are like a treating doctor. You are licensed there. That is, so you take care of the patients. You have to do your surgeries. And because it's a national healthcare system, that is a different way. So for that, doing a fellowship in the US or the UK, you have to plan. You have to plan about 2-3 years in advance and then work on that for the long-term fellowships. Short-term fellowships, there are many short-term fellowships where you can apply. Just go for observerships. These short-term 6 weeks or fellowships in the US, UK, definitely no hands-on, because their licensing exams and their rules are very different. So if you want to go for a substantial amount of a long-term fellowship, you need to plan a lot, at least 2 years of planning and then working, getting your licensing exam, then applying. You have to have a very strong CV, go for the interview, and then get the job.
Okay. Thank you, sir. Sir, now the world has become very close because of internet and all these live surgery sessions. Do you still feel that what surgeries are done in US or Germany, is it very different from a surgeon who is doing a high profile, fine-tuned surgeries in India? Do you think there is a lot of difference in the methodology or the skills, or will we be able to reproduce the same thing, what is good in their city at our place?
100% from based on my experience, and even in Ganga Hospital, we used to conduct these live surgery courses. So we usually find out that surgeons in India are excellent, and in fact, sometimes even better. So there is no difference in the surgical skills between surgeons, even in India, not only because of this, as you said, the whole world has become small because of, even in every developing country, even in the underdeveloping countries, like AO has done a very good job. So throughout the world now, fracture fixations, for example, has become uniform, standardized. So there is no difference in surgical skills between well-trained surgeons from India and abroad. There is no difference. Even the surgeries done are of the highest quality in India. One thing which abroad is, definitely far ahead of us is research. They are at least 10 years ahead of us, especially in UK and in US, because the whole structure and the funding for research is very different there. But surgeries wise, surgical skills wise, Indian surgeons are at par with anyone in the world. There's even the surgeries done, the same techniques, same things are even being done in very good centers across India.
Okay. Thank you, sir. Thank you. Siddhart, do you have anything to comment?
Yeah, so just like how Dr. Bhaskara sir had said, so in my short experience in the US as well, so I did notice that we Indians are definitely, I would say that we may be a little better skilled than people in the same experience level as compared to the US. But what I did find that the US was ahead of, do agree that we are behind with research. What is ahead is the availability of instrumentation. So in the US, so for example, the direct anterior approach, a lot of people use the table over there. So it can be done without the special OR table, but the OT table definitely does make a difference. It is a really expensive table, whereas in the US at the center that I was staying, there were 4 tables. So that costs in India, that cost approximately 1.5 crores, just the table. So also one day there was 6 revision hip surgeries that happened. So they were having the explant system readily available, whereas in the entire South India, I think there is only one explant set that is available in India. So that is where I think the abroad is ahead of India rather than the skills, the availability of the instrumentation.
Okay. Terence sir, what's your call?
I think just to add on to it, I personally have not done a fellowship or an observership abroad. But as you said, because we are so very well connected with the webinars and other stuff, and we have a lot of live surgeries happening at our center, a lot of stalwarts coming and operating here. As far as arthroscopy is concerned, I don't think we lack behind at any level as far as the surgical expertise is concerned. So every procedure that has been described or recently described is being done here, and we are at par with the West at any level in arthroscopy.
Okay. Thank you, sir. Now, we have last few questions. This is for Nirdesh. How do you prepare for any entrance like FNB? What's your... how long will it take?
So, well, exam based. Is there any echo?
Yeah, it's echoing.
One second.
Okay. Siddhart, how to prepare for a SIAA fellowship?
Akash, can I take the question?
Yeah, please.
Okay. So how to prepare for FNB exam? So exam based, I have already mentioned that there are FNB exam, Association of Spine Surgeon of India exam. Then you have a MCH of Rishikesh, AIIMS, and AIIMS exam properly, and PJ 2 years of exams, right? So as far as FNB is concerned, you need to prepare everything. So it is an MCQ based exam. So you need to plan at least 3 months before the exam. Okay. So, and MCQ based exam, you need to know all the specialty. That is the bad thing about FNB exam is what I feel. If you want to pursue a spine surgery, you need to read about the arthroplasty, hand microsurgery, scopy. As far as other exams are concerned, in ASI exam, you need to prepare only for the spine part of orthopedics, and there will be an interview after your exams as well. So these are the main things. So I feel at least 2.5 months should be fine for preparing for FNB exam.
Okay. Siddhart, is there any different way to read or prepare for a SIAA fellowship?
So for the SIAA fellowship, your prerequisite is to have to be at least 1 year post MS or DNB. So we have a interview and an exam at Sparsh Hospital, Bangalore. So based on the exam and then the interview, they do the selection process where they do select 4 people. So generally 60% of the paper is general orthopedics and 40%, I guess most of the exam fellowship exams also in the same pattern, 40% will be the subspecialty.
Okay. Vasu sir, you want to comment?
Yeah, coming to hand surgery fellowship entrance, can you? I hope you are hearing me properly.
Yeah. Yes, sir.
Yeah. As we all know, hand surgery FNB can be given by general surgeons, plastic surgeons, and orthopods. So the paper for FNB hand surgery will be completely different from the trauma, scopy, spine, and all. you need to know the basic orthopedics, but I think you should concentrate more on fourth volume of Campbell, where congenital hand and microsurgery is given in detail. And apart from that, they might ask you a few general surgery questions as well, which you may need to look into it, or you can just skip it. So that they have asked a classification of prostate cancer for us in FNB hand surgery. And they will ask a few questions on microsurgery part of it. It may not be in detail, like the suture use, jewelers, what is jewelers forceps, and all that stuff. So it's a little bit different from the other FNB entrances. I think knowing the entire orthopedics may not be that important for hand surgery, but knowing a little bit of general surgery, basics of plastic surgery and microsurgery, which is not that tough to understand. There are few small books available for that. You can just go through the books. That's it.
Okay, my next question, we are coming almost near to the end of the session. Dr. Raghavendra, you have worked in multiple centers. You have done a pediatric fellowship followed by a scopy. Then you have worked in Ganga, now presently in AIIMS. So what to expect in a fellowship?
So, as already
will
said,
will they have a luxury like a post MS that feeling high of being like a consultant? Can anyone expect
definitely
that?
Definitely different from what you do. So one thing is that during fellowship, it will be like just like same thing as a PG life. Nothing different from that. Definitely you should work like a PG. Only thing is that never expect much of stipend. So stipend should be basics, as sir said already, that it should be around 50,000. That is so that you can live. But only thing is that you should give your time. Basically, if you give time for at least 2 years, what you want to learn, so then that is sufficient. So as I worked in different centers, I had got different stipend as well. So never thought of stipend first thing. So the thing is that what you want to learn from different surgeons. That's what I thought. So that's what I gained from them. Different centers have taught me one or the other thing, new thing, which I was not knowing in the previous center. So you'll get different experience, but that will be helpful for your future. So that adds up for you. Not about money. So once you settle, they definitely can earn that. That is not an issue. But only thing is that you should provide your time, basic time, at least for 2 to 3 years, which I think so. So post MS, never think of money. First thing. Second thing is that concentrate on what you want and where you want to settle. So if you want to settle in a metro cities or 2-tier cities, definitely it needs fellowships. So work for a long time. So then once you are expert in it, then you can do whatever. You can earn about the money, not a good thing, not about the money, but you can earn the money later on. But only thing is that what you want to learn is the focus on that. So then you can be an expert in that.
Okay. So Terence, sir?
Akash, one thing that our boss used to always tell here is that a fellow gets to learn out of your boss's 20 years experience. So what he has taken 20 years to learn, you have to pick it up in 1 year. So it's a tremendous task on you. So you have to be on your toes full time. I think basic stipend, as we all discuss, is required. And one thing for all fellows who come in is to remember that you should never feel entitled. In the sense, you feel that you're working here and there, what is happening, right? Because I felt that when I came initially, because from a consultant post where I was working in, I came down here, and then, when you start working as PGs, it's a little difficult for you to take it. And, you should stop feeling entitled, do your basic work, and, eventually you start getting cases and boss feels confident in you that you can handle the case. And then, you start getting hands-on as well. So don't expect, the first question everybody asks is, do you get hands-on? Yes, it's very, very important to get hands-on, even in Scopy as well. You will get enough hands-on. And to add on to it, as far as Scopy is concerned, you have a lot of cadaveric workshops now. Every fortnight, every month, there are cadaveric workshops in knee as well as shoulder. They are also good enough for giving you a practical boost. So I think with the practical expectation of good balance, academics and hands-on that you have to expect out of a fellowship.
Okay. So I feel like it's my opinion when you join a fellowship, you should be grounded. You don't expect any comfort or nothing. Just as everyone mentioned, it will just you'll be working as a first year PG, and second year of fellowship will be a bit better. So there are a few questions from the YouTube. Are we doing fellowship just because there is saturation of orthopedics and to have a better selection from the in the interviews? Anyone want to take up this question? Nirdesh, please.
Yes. It all happened 2 years back when I had thought that orthopedics is just an end branch. So orthopedics is not an end branch at all. And it is happening now as well. After FNB spine, it is not it is a never ending process, right? So it is not for the sake of a fellowship or adding to the CV why you are doing. So it is no more general orthopedician. It is orthopedic spine surgeon or an orthopedic scopy surgeon or arthroplasty surgeon. This is how people will be calling you in future. So even in 2-tier cities, we have seen a lot of orthoscopy, plasty and spine surgeon. They have started operating. So maybe near future, we will have to go for this only. It is not just orthopedics. You need to have a fellowship for survival in future.
Okay. So, okay, the next, okay, we are almost end of this session. So there are a few questions which I want to put across the panelists here. So what is the pass percentage of FNB? Is it as low as DNB? So before taking up FNB, they want to think about the passing the exam. Terence, sir.
Yeah, I can just tell from my FNB experience that not everybody clears, but it is not as bad. Like if you have 6 candidates writing the exam for Scopy as per se, if you have worked in a decent center with a good practical knowledge and an average academic knowledge, I think you should be comfortably able to clear. So out of 6 or 7, unfortunately, one doesn't clear. Sometimes it's a full on for Scopy.
Okay. So anything else? Anyone attending the live session through Zoom? You have anything to ask? Okay. So we are coming to the, these are the, okay, sorry. Mail IDs of the panelists here. Hope everyone is able to have a view. You can mail to the concerned specialist on this platform so that they'll be able to help you or guide you with the list of the fellowship courses, what are available, and to give a priority to choose. So any closing remarks? Bhaskara sir, any closing remarks?
So I would just like to tell one small thing that, as Terence was telling, the feeling of entitlement. If you think that, okay, you passed MS Orthopedics, you're doing a service to any institution or any hospital, then you are always starting on the back foot. You have to be prepared to really work hard. And as it's surgeons, so many years of experience. So most important thing is, always remember you're going to be a fellow only for 2 years. And then the rest of your life, you are going to be a consultant. And when you become a consultant, you can't be making any mistakes. As a fellow, you can make small mistakes. As a postgraduate, you can make mistakes. Public, and you are always under the guidance or under the supervision of a consultant. Once you become a consultant, so you're a consultant for life. So always make sure that, in these 2-3 years of fellowship, wherever you go, that you give your best and you are willing to work very hard and make the best out of it, because what you learn in the fellowship, it's going to be your life. That is going to be your entire career for the rest of your life, which is going to give you a name. And so all of you, all the postgraduates who are attending, I'm sure that, all of you, even finishing orthopedics is a very big task in India. It's very good. And all of you will definitely, you would have learned some very good points from here. And all of you, will definitely shine in your career. Thank you.
Yeah. Thank you, sir. Thank you. So I would like to conclude the today's session, and thank all the panelists for sparing their weekends, Saturday evening, to help, or to share their experience And I thank personally Dr. Siddhart, Dr. Terence, Dr. Bhaskara sir, Dr. Nirdesh, Dr. Raghavendra, and Dr. Vasu sir. Okay, so we'll be concluding the session, and I thank all the participants also. We had almost 50 participants in Zoom and many more on YouTube live, as well as in OrthoTV, as this session is recorded and people can view this on later also. Thank you, everyone. Anything to comment? Any panelists?
Well, please, can you please display, because many of them are asking in the chat box for the email ID. So just display that. That would be.
Yeah. Is it visible now?
Yeah, it is.
Okay.
So Akash, I think this initiative by your team, it was excellent, and thanks for all coordinating this whole session with all of us. That is what is most important, and you did a great job by moderating as well.
Thanks, Akash. Thanks for the opportunity. Thanks for the White Army as well as the OrthoTV for providing me the opportunity to share my views on PEDO.
Thank you. Actually, this thought was given by Dr. Nirdesh, who thought, then we started initially with 2 to 3 panelists, then expanded by Dr. Terence, who told, okay, there are multiple specialities, and I thank all their for inputs and guiding to have conducting this session. Thank you, sir.
Thank you, Akash. Thank you,
These are, as far as the fellowships in India is concerned. So we can plan one more session probably for the things which are outside India. So we can
that
plan
would be great. Yes.
Yeah, probably next session we can have on the how to approach a fellowship, extended fellowships. Okay. Thank you, everyone.
Thank you, everyone.
Thanks, Akash.
Thank you, Akash. Thank you for the opportunity. It was a great show.
Okay. Thank you, sir. Good night. Have a great weekend. Yeah. Thank you.
Good night. Thank you.
Okay. Thank you.